Well, Mr. President, as you know, I'm the chairman of the Environment and Public Works Committee, and it is a joy for me to have that job, really, truly, because my whole life I've cared about environment and I've cared about infrastructure. And the way the Senate works, they put those two together. So not only do I get to talk about clean air and clean water and safe drinking water and cleaning up Superfund sites and protecting the health of our families, but I also get to talk about jobs that are created when we build roads and bridges and highways and water systems. But there is something that does not bring us together on that committee, and that's the issue of climate change. And so what I've decided to do is to come down to the floor every Monday that it's possible for me to do it, and the floor is available, to talk just a few minutes about the devastating consequences of unchecked climate disruption. And I want to discuss and put into the record every week the latest scientific information. On March 4th, I started these talks, and I talked about a front-page story in the USA Today that spotlighted the impacts of climate change unfolding around us. The story is the first in a year-long series called Why You Should Sweat Climate Change, and it described how climate disruption is happening all around us. Last week, I discussed a report entitled the 2013 High Risk List. That was a GAO study, a government accountability study, that said climate disruption is leading to intense weather events like Superstorm Sandy, and they threaten our nation and the finances of our nation. Plus, I told colleagues of an Oregon State study which appeared in Scientific American, which said that we have had the warmest decade in over 11,000 years. The warmest decade in over 11,000 years. Not 11 years, not 1,100 years, 11,000 years. So, Earth, to my Republican colleagues, please wake up to this fact and let's do something about it. Well, today I want to talk about the impact of unchecked climate change on the health of our people. According to Dr. Cecil Wilson, and let's look at this, former president of the AMA, the American Medical Association, he says the scientific evidence clearly indicates that our climate is changing, air pollution is increasing, weather is becoming more extreme, and with these changes come public health consequences. And that is why our president made a finding that there actually is a danger to public health. It's called an endangerment finding for a reason. It is putting our people in danger. Wake up, colleagues, please, wake up before it's too late. The fact is the Bush administration found, and we got this through documentation, that climate change was a threat. The CIA has found that climate change is a threat. The defense establishment has found that climate change is a threat. The only place that doesn't seem to get excited about it is right here in a bipartisan way in the U.S. Senate. We know, again, temperatures are continuing to increase. The draft National Climate Assessment, January 11, 2013, said, heat caused by climate disruption is especially harmful to our children. Now, I want to talk to colleagues who might just be listening. They might not be, because it is 7:20 at night, but if they are, you all say you want to protect our kids. You all love your children and your grandchildren and your nieces and your nephews. According to the American Academy of Pediatrics Committee, and I think we have a chart on that, anticipated direct health consequences of climate change include injury and death from extreme weather events and natural disasters, increases in air pollution-related illness, and more heat-related, potentially fatal illness. Within all of these categories, children have increased vulnerability compared with other groups. Again, I say to my colleagues, if we were sent here to do anything, It's to protect the health and safety of our children, for goodness sakes. And they are one of the most vulnerable groups if we don't act on climate change. And now, if that doesn't move you, I say to my friends, what about the elderly? They are particularly vulnerable. And this is from the draft National Climate Assessment. Older people are at much higher risk of dying during extreme heat events. Pre-existing health conditions also make the elderly susceptible to cardiac and respiratory impacts of air pollution and to more severe consequences from infectious diseases. So if I didn't touch your heart with your kids and your grandkids, how about your grandmas, your grandpas, your great-grandmas, and your great-grandpas? Because they also are terribly vulnerable to the impacts of climate change. Lawrence Kalkstein, a University of Miami professor who studies the effect of heat on health, says that climate change is the silent killer. Heat can cause fatalities among even the fittest. He says it's a silent killer. This man knows because he studies the impact of heat on our health. So let's not be silent about this here. Maybe climate change is a silent killer, but we can't be silent in the face of the information we have. The warming planet can cause many other serious health problems that are harmful to our families. Scientists predict they'll get worse. Scientists believe it will only get worse. Listen to what they say. Heat waves are also associated with increased hospital admissions for cardiovascular, kidney, and respiratory disorders. Extreme summer heat is increasing in the U.S., and climate projections indicate that extreme heat events will be much more frequent and intense in coming decades. Is this the future we want for our people? Increased hospital admissions for cardiovascular, kidney, and respiratory disorders? I think not, but boy, part of me thinks so. I can't seem to get anybody excited about this in the United States Senate. You might ask me why, and I have my theories. There's a lot of power on the other side. There's a lot of power on the other side. People who don't want to move off coal, people who don't want to move off oil. There's a lot of power on the other side. The increase in temperatures can lead to respiratory illnesses associated with air pollution, such as asthma. Have you ever seen a child with asthma gasping for breath? I say to my colleagues, asthma is a leading cause of hospital admissions for kids at school. And I go around, I visit the schools, and I ask a simple question. How many of you kids here have asthma or know some with asthma? Almost 50% of the room, hands up. If you saw a child gasping for air in the street, you would hold them close, you would calm them down, you would get them oxygen, you would do everything in your power. You'd call 911, you'd take them to the hospital, you'd sit by their side, you'd hold their hand, you'd nurse them back to health. We have a situation, folks, that climate disruption is going to bring us more cases of asthma. Let's not stand with the giant polluters here. Let's move to clean energy. Let's clean up our act. Let's save our children, save our grandparents. We're not talking about a remote possibility sometime in the near future. Climate disruption is here. It's happening before our eyes. More American children are getting asthma and allergies. More seniors are suffering from heat strokes. Let me tell you about what's happening in New York right now. We're seeing indications that extreme weather events like Superstorm Sandy are linked to health problems. Do you know they've already given a name to a cough that has developed in that part of the country, locally known as the Rockaway cough, because it's in Rockaway. The Rockaway Peninsula, on Long Island, New York, was devastated by Sandy. Lives were lost, homes and businesses were destroyed, and now local residents are experiencing health problems from the flooding. Coughing, it's a common symptom that health officials said could come from mold or the haze of dust and sand kicked up by the storm and demolitions. And if you listen to Governor Cuomo, what he said was that they're seeing these so-called 100-year storms, which are supposed to come once in 100 years, all the time. I say to my colleagues, wake up to the truth. Look out the window. Figure it out. Look at this. Is this what we want to see in our country? You know, I was talking to Senator Warren about what happened recently, and I was shocked to see houses in Massachusetts on the beach, beautiful homes being totally razed and taken away because the ocean is moving so close they can't stay there. It's happening before our eyes, right here. Haze and dust and sand kicked up by the storm and demolitions. The air in the Rockaways is so full of particles that the traffic police wear masks, though many recovery workers do not, and that worries people who recall the fallout of another disaster. Now, another real threat that we're seeing more and more in the West, wildfires. Wildfire smoke contains dangerous compounds. Why do we see these? The droughts that are coming. Smoke exposure increases respiratory and cardiovascular hospitalizations, emergency department visits for asthma, bronchitis, chest pain, chronic obstructive pulmonary disease, respiratory infections, medical visits for lung illnesses has long been associated with hundreds of thousands of global deaths annually. So we know that that's the bad news. Now, if I stopped here, I wouldn't sleep very well tonight, having gone through all of this. But there's good news. We can take steps now to address climate change, and those steps will benefit public health. We have an opportunity to turn this crisis into a win-win situation. When we reduce carbon pollution from power plants to address climate disruption, we reduce dangerous air pollutants like soot and toxic metals that are harmful to our health. And here's a chart. Policies and other strategies intended to reduce carbon pollution and mitigate climate change can often have independent influences on human health. For example, when you reduce carbon emissions, you reduce air pollutants like particles and sulfur dioxide. And we call that co-benefits, Mr. President. When you go after one kind of pollution, carbon pollution, you get the co-benefits of going after the soot, the small particles that lodge in the lungs of our vulnerable. So we know when we reduce carbon emissions, we reduce those small particles and sulfur dioxide. Now, here's the other good news. As we move away from the very dirty, I would say, power sources of what I hope will be the past, and we move toward clean energy, we help our families' budgets. Because when we move away from polluting automobiles, and I drive a plug-in hybrid car, and I got to tell you, it's pretty amazing. I get the first 12 miles on electricity, and if I do a few chores, then I come home and plug in the car again. And then when I go past the 12 miles, it goes to a hybrid, which is part gas, part electric. So overall, I'm getting about 150 miles to the gallon. You know what? That feels pretty good when you don't have to stop and fill up your car all the time and get a sweat because of what it costs to fill up that car. We're moving with the help of President Obama and this Senate, and I have to compliment my colleague, Senator Feinstein, and my former colleague, Senator Snowe, who in a bipartisan way moved us toward fuel efficiency, and this president helped us and led the way. And we are moving up toward 50 miles per gallon fuel efficiency, and that is going to really help us. But we have to do more. We have to do more because the health costs associated with climate change are heartbreaking and expensive. Taking steps to reduce carbon pollution will lower our doctors' bills when we don't have kids wheezing and gasping for air. The evidence is clear. Climate change is a public health threat. Now, we have moved before when we've seen threats to public health. We did it on cigarettes. I was here when the Congress voted to ban smoking on airplanes. Let me tell you, that was a hard vote. We had all the money of the cigarette tobacco companies against us. And I want to compliment Senators Lautenberg and Durbin. Senator Durbin was in the House. Senator Lautenberg, this is a long time ago. But I could tell you what it was like, because I do so much travel across the country. Mr. President, I'd get off the plane where there was smoking, and you reeked of smoke. You felt it all over, and you certainly were breathing it in. It was unhealthful. And everyone said, it'll never happen. You'll never, ever ban smoking on the airlines. But guess what? We did the right thing. Now, some people say, well, how do you know that human activity and the kinds of power we're using, the dirty oil and so on, and coal, is causing this? Let me tell you how I know. 98% of the scientists tell me so. And people say, well, what if they're wrong? 98% of the scientists agree that human activity is causing this climate disruption. If you stand with the 2%, you're standing with the 2% who said that smoking never caused lung cancer. I mean, I would say to you, Mr. President, if you or I went to the doctor and the doctor looked at us and said, you know, there's a 98% chance if you don't change your eating habits or your smoking habits, you know, you're going to die an early death. You'd say, 98% chance? Okay, I'll change my ways. Well, 98% of the scientists are telling us to change our ways when it comes to carbon pollution. And how do you do that, Mr. President? In a way that is smart. We have several bills to put a price on carbon. We have the Sanders-Boxer bill. We have the White House bill. There will be other bills. Once you put a price on carbon, it makes sense because you're factoring in the true cost of carbon pollution, which I just explained to you is enormous. Public health alone, economics related to superstorms and the rest. So we need to put a price on carbon. And what Bernie Sanders and I do is we take the funds that come in from that and we give it right back to the people and say, here's a check, and now you can pay for your new clean energy. It's kind of a capping the carbon and giving a dividend to the people. And with the rest of the money, we lower the deficit, and with the rest of the money, we invest in solar rooftops, a little bit in transportation. It's the way to go. It's the way to go. Now, some say wait. Some say wait. We can't wait. We wasted 8 long years when George W. Bush was president. You know why, Mr. President? He said that carbon pollution wasn't covered in the Clean Air Act. Well, all you had to do is read the Clean Air Act, and I'm not an attorney, but it's right there. Right there, it says, in essence, here are the following pollutants that are covered, and it listed greenhouse gas emissions. But, oh no, we had to take it all the way. He took it all the way to the Supreme Court and wasted 8 long years while the problem gets worse and worse. So here's the deal. Here's a quote, Washington School of Public Health, University of Washington. Dr. Howard Frumkin says, in public health, when faced with threats to entire populations, we act. For infectious diseases, we vaccinate. If 98% of the doctors and the scientists say vaccinate to prevent illness, there's always 2% who are going to say don't do it, but we go with 98%. We vaccinate. For lung cancer, we banned smoking. We didn't stand with the doctors who were paid off by big tobacco. We stood with the doctors who had an independent judgment, and we banned smoking on airplanes and in close quarters and on the Senate cloakroom and all the other places, in buildings, government buildings. For injuries, we installed seat belts and airbags, another big battle. Remember that battle? The auto companies said, oh no, we don't want to spend the money installing airbags or seat belts. Well, we said, you have to do it. You know what? It's worth the cost. And so many lives are saved. For obesity, we promote physical activity and healthier eating. The First Lady has taken this on as a cause. And we're starting to see a change. We have a long way to go. Why do that? Because we know the connection between obesity and diabetes and heart disease and stroke. So even though it's a difficult issue, we've tackled it. And for climate change, he says, we need to act. And we surely do. So, Mr. President, I'm talking really to pretty much an empty chamber, but I'm glad you're there. And I feel a few people are watching. It's good. But there are a few of us here who are determined to keep on bringing the facts to the floor of the Senate. You know, everyone has a right to act or not act. But I believe we need to make the record now, because when my grandchildren grow up, I want them to look back and say, wow, that was great what Grandma's generation did. They took care of this issue. I don't want them to look back and say, what were they thinking? What was wrong with them? Why didn't they act when they could have made a difference? And so next week I'll be back. I'll be talking about national security threats. This is one of the biggest national security threats we face. That doesn't come from me. That comes from the Pentagon. It comes from the CIA. It comes from the national security team. So we can just close our eyes to this. We can wish it goes away. It's not going away. But we can ease the pain of climate disruption by moving to clean energy, energy efficiency. And we will face a win-win as we eventually have better public health, save money, and save the planet. Thank you very much, Mr. President. I yield the floor, and I would note the absence of a quorum.